which has been sanctioned by none other than our beloved Prime Minister Shri Narendra Modi ji for the state of Goa, for the cost of over 400 crores. That is, if you take into consideration the equipment, other costs. So basically, today that hospital, we are in the process of commissioning it fully, which was inaugurated also lately on 19 December at the hands of the Honorable Prime Minister. South Goa District Hospital has also been completed and commissioned. We are in the final stages of commissioning the Pedne Hospital. There also certain basic facilities have been started. All this involves infrastructure, health infrastructure of more than 1,000 and odd crores. Now if you ask me the breakup, how we have been going about, we started assessing and doing an analysis of what is required in the state of Goa. And when I took over as the health minister under late Chief Minister Shri Manohar Parrikar and now under Dr. Pramod Sawant, what we decided as a party, what is the philosophy of the Bharatiya Janata Party, is outreach and to see that best of healthcare is provided to the people of the state of Goa. We started dialysis centers in different hospitals all over the state of Goa. People used to come earlier only to Goa Medical College until late night. They had to take dialysis and other things, as a result of which it was becoming very difficult for them, and providing this type of care for people who are suffering and in that type of condition. So as a result, we tied up with another agency and we have opened several dialysis centers across the state of Goa. And this has benefited a large number of people. In addition to that, people have given us such a positive feedback. You have also been a party to see a lot of inaugurations in different centers. This is not there in all the states in the country. A lot of people come here, dress well and boast of the facilities in their state when there is absolutely nothing. As far as the state government is concerned of Goa, during this period we assessed, one is taking up and completion of the super specialty hospital, which is a challenge. We have also now started work on the, like I've already said earlier, the foundation that was laid by Dr. Pramod Sawant of the tertiary cancer hospital, that work also is fully started. That cost is somewhere around 270 crores. We have got sufficient amount of funding from the central government for this particular project. And whole idea was that people from the state of Goa should not go outside the state of Goa for cancer care. People sitting in the audience will know that there are several people who go to Tata Memorial and many other renowned hospitals, but have to wait there for so many days to complete the whole testing and diagnostic procedures. And only then some doctor meets them to give them exactly what is required. Goa is the only state where this hospital, this tertiary cancer center will not only take care of Goa, people of Goa, but also right up to Ratnagiri and this side, right up to Hubli, this whole belt will be covered by this particular center. So it's a center of great importance for us. In addition, we have got sufficient funds, state government and also the central government has given us to make IPHP a center of excellence. All of you know that today, because of pandemic and various issues related to the pandemic, people require counseling and several issues related to mental health and mental health well-being. As a result of which, we have fast-tracked the completion of this particular hospital. We have also tied up with the renowned Institute of NIMHANS, which is in Bangalore, so that we are able to have exchange programs and we are able to give proper quality care to the people who require this type of counseling. Counseling is not only restricted to adults. Counseling is also, due to the pandemic, there are a large amount of children who require counseling. Hence we tied up with NIMHANS so that we are able to have best quality people and who are able to engage with our doctors, and we are able to provide this type of quality services to the people of the state of Goa. After that, if you look at the 108, we have further strengthened. The only 108 to have cardiac ambulances in the whole country. The only 108 to have neonatal ambulances in the country. And we have spent a lot of money. In addition, now we are getting another 14 to 15 new ambulances so that our fleet will go up to about 75. The whole idea is to see that our response time increases and we are able to reach out to the patient who requires emergency care within a span of 7 to 10 minutes. There may be some unusual cases sometimes because of COVID. We had engaged certain ambulances only for COVID. That time there were some issues. But otherwise, we have been carrying out these type of facilities and outreach programs all over the state of Goa. Our facilities, emergency services, we have also started several other 108 also we have also started for domestic violence and several other through WCD. But we also must understand that in the state of Goa, the infrastructure that is available and also infrastructure that is available, we have also opened more emergency care centers all across the state of Goa. And places like Kankon, places like Sangay, places like Kepe, everywhere we have got 24/7 emergency centers, so that in the night if there is any emergency. Apart from that, we have got more than 12 to 14 STEMI centers, which is not there anywhere in the country. Niti Aayog gave Trigog an award. Trigog is our partner in this STEMI program. And they got an award for the best innovation that they carried out, because our patients who get a heart attack in the rural area earlier were dependent only on reaching the hospital. Today in the PHC itself, on the way, we are able to, through Wi-Fi, transmit the ECG of the particular patient, and then we are able to treat that particular patient in that particular PHC by giving them Elexin and stabilizing them, so that any side effects of that injection we are able to stabilize. We have understood this whole protocol, and then we are then taking to the closest center for intervention. Now, when we are talking about healthcare, I get amazed sometimes listening to press conferences of various people from the opposition, because they like to only hype things which they have not achieved in their respective states. But I would like to share both things with you. Today, when we are talking about healthcare, apart from this, DDSSY is one of the most unique schemes in the state of country, which is integrated now with PMJ. In addition to this, we have to also see what are the facilities, what is the medication that is being provided by the state government to the people of the state of Goa. We are spending more than 120 crores every year annually only in Goa Medical College to give free medicines to patients at the OPD level and inpatients. Life-saving drugs, which is not given free of charge in any state in the country, is given free of charge in the state of Goa. We have also tied up with Dr. Amit Maideo to start a gastroenterology department in the new super specialty hospital. We have also taken a Dr. Sanat Bhatkar, who is a ex-student of Goa Medical College, who has joined. Cabinet has just approved recently for aneurysms. Because whenever strokes are there, aneurysm, we have Dr. Karapurkar, who is originally a Goan and working out of Bombay, who is one of the top specialists in aneurysm, trained by the main father of this particular protocol that was started in this procedure from France. Dr. Karapurkar also happened to treat my father when he had an issue. And this Dr. Karapurkar is a Goan origin, and we are proud, that we are associated with somebody like him, who suggested to us that large amount of stroke cases are increasing in the state of Goa. So as a result of which, that you must take this type of a doctor, who's your own doctor from Goa Medical College, who will do justice to the people of the state of Goa. Aneurysm is nothing but through the groin. When you send platinum coils into the inside the brain, wherever the coiling is required, so you can do that. You can use the same cath lab for that particular procedure. And also in addition, we must understand that we are going on a fast track as far as the healthcare is concerned. And we are providing this type of a varied services. We have got one of the state-of-art labs also in our Goa Medical College. Today our testing facility is one of the most excellent. We have got a virology lab, which is one of the state-of-art facilities in the country. Soon, by 15th, we are expecting to have the genome sequencing machine also in the state of Goa, so that because a lot of cases are getting converted from Delta to variant into the Omicron. In addition to this, you have to also see, all our press members and members of the media have seen these programs. These have been repeated in every newspaper and through your channels, because many of you have been part of it over a period of time, over the period of 5 years. Now, when we go step by step, we have also enhanced each and every facility, each and every infrastructure in the area of healthcare, and trying to open up new areas. We have even child care centers, which is pertaining to neuro rehab and other things, also have been upgraded. Goa, we are giving free of charge services for the neuro rehab children that require pediatric neuro rehab care. We have also tied up with certain top specialists to come and specially operate in Goa Medical College. Now, yes, we have also given a commitment to the people of the state of Goa that South Goa District Hospital will have its own cath lab. Process is on. We have also tied up with HLL, which is the Government of India public sector undertaking, to run all the diagnostic centers for us. We are going to go by the hub and spoke model. They'll help us in putting up the cath labs in the super specialty hospital and even in the South Goa district hospital. We are in the process of already starting and to get more doctors on board so that we can have the 4th and 5th unit in the South Goa district hospital. I also have suggested that we should have 1 unit in the Chikalim hospital so that we are able to cover Marmugao Taluka. When we are doing all this, IUI and IVF, also the treatments that we have also commissioned, started in Goa Medical College, which normally if you see Goicha Lokang, when people from Goa used to go outside the state of Goa to doctors in Pune and all, they used to get virtually looted. And as a result of which we are giving this treatment, is expensive treatment. Virtually works out about 7 to 9 lakhs rupees per person. That we are giving free of charge in Goa Medical College. We have started it and it is successfully being run by our team of doctors in the gynec department. In addition, the North Goa District Hospital also under the ERCP, we have Government of India has given us funds to further enhance our facilities. ECRP 1 and ECRP 2, we have already now commissioning our ICU facilities in the district hospitals. And also we have got 100-bedded pediatric ICU in the super specialty block. When we are talking, there's so much to talk. I can go on for another half an hour telling you exactly what we have done in the state of Goa. I would like to also tell you that we have learned through experiences of COVID, and today also we are equipped to deal with any kind of emergency situation as far as COVID is concerned. Goa is the only state that gave free medication for COVID, free treatment, and everything was given free of charge to a person. Somebody that day, I did not make a mistake. Somebody deliberately twisted what I said. I said we spent 1 lakh of rupees on a person who was admitted in the hospital if you take the admission for a period of 10 days. It was not 10 lakhs. It may have sounded good for somebody from the opposition to hype it, but it was absolutely stupidity on his part, because we all are educated and we understand what are the costs. Now when we do this, we have given all the care, attention to the people of the state of Goa during the period of COVID. Today we have very less number of admissions in the hospital. Even then we are dealing, we have reached a certain level, as a result of which our doctors have already made a plan in place which has been discussed with the experts, stage 1, stage 2, stage 3, stage 4, and at the main peak stage what steps need to be taken, that at regular intervals will unfold and tell you. Many times if we have a vaccination program given by our Honorable Prime Minister, this vaccination in the country has been successful only because of the free vaccination that was given by our Prime Minister, Shri Narendra Modi ji, for every state. Before that you know that every state was trying to call for a global tender, nobody was able to procure the injection. It's only when the Prime Minister stepped in, and that's when we were able to get the vaccination each stage, and today also we have sufficient stock of vaccination. School children are being vaccinated, children between the age of 15 and 18, students have been vaccinated. That is also going on. Vaccination has been a great success in the state of Goa. We have crossed 95% in terms of the second dose that is to be given. And whatever has been given as far as state protocol is concerned and the national protocol is concerned, the other day with the Health Minister of Government of India, we had a very long discussion, and they were very happy about what we are doing in the state of Goa in terms of the protocols to be followed, in terms of vaccination and other things to keep people safe. In addition, the state government has done all this in the state of Goa over the period of 5 years. WCD, we are giving nutrition. We have started this with this PHFI, which is a Public Health Foundation of India. Dr. Srinath Reddy, who was the main brain behind the PMJ, who has given us this. We have got this equipment called Swas Sakhi, which they go with the Anganwadi workers and keep the records of risky pregnancies, other things, so that they can integrate it along with the health department. So basically what I am trying to tell you, we have not only done things at the top, free insulin to everybody, food clinics in every PHC, CHC. So if you ask me, there are several things that we have done, and we have even taken these programs and also monitoring nutrition and other things, fortified food to the Anganwadi, to the adolescent girls and all the children, which requires so that whole infant mortality numbers come down, which has come down. We are pretty good in terms of infant mortality. It has come down to a great extent because of the nutrition and because of the monitoring of the pregnant women and the lactating mother. Both has been taken care of by the Department of WCD. Our scheme as far as the Ladli Lakshmi and Grah Aadhar also started by our late Chief Minister Shri Manohar Parrikar also has been a success, and it is going on smoothly. Every payment has been made up to date as of this month. Whatever payment needs to be released, and last installment to bring it up to date till December, will be made in the next, should be any moment. It's already gone to the accounts. In addition, if you look at it, and in terms of the pandemic, the 2 years of pandemic has pushed industry a little on the backward kind of a thing, as a result of which we could not make that type of headway that we require. But a lot of things we have pitched for the medical device park and several other things to see that we are able to kickstart the economy in a different way in terms of industries is concerned. Smoothing and allotment of land and several other things, though some people may go on making allegations, you have to tweak the procedure so that you are able to move forward. So in addition to this, when the media is sitting here, that we have done so much in the area of healthcare, and also now we are bringing out rural medical dispensaries. We have also assured, and we have also said that the government is in the process of building out of 1,262 Anganwadis. We have already started at about 17, 18, and the whole idea of the government over the next 5 years would be completing all of them into state-of-art Anganwadis, which have got counseling centers from each and every facility in that, so that there is no gap between a rich man's children going to a play school and a poor man's children going to Anganwadi. Digitization of Anganwadi in Sattari has been completed on a pilot project through CSR, and in addition, we are carrying out this particular digitization of Anganwadis in every part of the state, and that has been our forte as far as, and our more priority in terms of the WCD department. Skilling, we have tied up with GE. Old Asilo is being used for specific courses, so that we are able to train the people and equip them so that they can upskill themselves, so that we treat every individual as an exportable commodity, so that he is able to equip himself so that anywhere, any part of the world, he is able to get a job. In addition, Siemens has also become our knowledge partner to tell us and guide us how to move forward. So these are several things that we have done, and we want to move ahead. And this is how this is. Now, if there are several initiatives in addition to this, what we have carried out, but I thought this is more or less a broad outline as to what we have done in the state of Goa as far as the health sector is concerned in the state of Goa over the last 5 years.
You said about different facilities given for infrastructure and treatment. During past 5 years, at what amount would you place the money spent on these particular health sector?
Anywhere. See, being very practical, only building infrastructure should be about 1,000 crores. But other running expenditure, much and operationalizing all these things, and money that we are spending is much more. That I can give you the specifics and statistics, because these are the few things which I thought I should highlight today and what we are doing. Also, now what we have done is, I forgot to mention the last point, that we tied up with HLL. We have taken a cabinet decision by nomination to tie up with HLL. We are going to do a hub and spoke model, because whenever you get a stroke, you need a CT scan. Whenever we find that many times the radiologists, there is a shortage, we are going to tie up with HLL for all the PHCs, CHCs, as well as the Goa Medical College Super Specialty Block, so that we are able to have HLL run this on a hub and spoke model basis, so that people do not have to move from their respective constituencies or wherever the PHCs to any other place for any X-ray or for an ultrasound or a color Doppler or for anything. And we have already had this, the agreement, final stages of the agreement are going on, but as far as cabinet is concerned, cabinet has already approved the same. म्हाका दिसता आमकां जे गायडलायन दिल्या ह्या लोकांनी स्कोप ऑफ वर्क धरून एक 12 ते 13 महिन्या भितर कंप्लीट जातले. आनी तुमकां खबर आहा की सुपर स्पेशालिटी हॉस्पिटल बी आमी 14 म्हयन्यान आमी कंप्लीट करून उबे केले. पण आमकां त्याच एजन्सीक आमी कॉन्ट्रॅक्ट दिल्या. गव्हर्मेंट ऑफ इंडियाची एजन्सी आहा, त्या एजन्सी तेच काम ते फुडें व्हरतात. There is no shortage, absolutely no shortage. See, Ribandar, what was our purview is to start the center there, which we have started. We have already put it under Goa Medical College. Plus minus, when you start a new center, there are issues. But Goa Medical College will monitor the whole thing and ensure that DHS and Goa Medical College will monitor that. We have kept Dr. Indira Fonseca there to look after the facilities there. But if there is any update, she will give it to us, and we always support it totally. We have kept a dedicated ambulance also for the people of Raivandar on the request of the local MLA, and that's how we plan to move forward.
So frontline workers are diverted to election commission.
Already letter has been issued and they have agreed to relieve them.
All are relieved.
Yes, health cannot when there is a pandemic.
Viral lab आणि genome sequence काय कुठली
पुढेपर्यंत आले कारण आम्ही 2 वर्ष झालं ऐकतोय हे.
हे बघा 2 वर्षाचा प्रश्नच येऊ शकत नाही. कोण मिस्टर लाड ते 2 वर्ष झालेलं नाही. जिनोम सिक्वेन्सिंगचं सजेशन आम्ही केलं होतं. Genome sequencing at that point of time was not very important at that point of time because we could test it through RT-PCR. Genome sequencing was seen because there was a talk of the virus mutating further and further. Today, as far as we are concerned, there is a virus that is mutating, and in order for us, because otherwise we will be sticking to all the cases and calling it Delta. NIV is under a lot of load. USAID, along with Japago, has already given us commitment that by 15 the machine will be here. And we will run and they will give us free of cost kits for the period of 1 year, and then the state government will take it over. I think that should suffice. Whatever machine capacity that they're giving us, and it's not only easy to place an order for a machine. All over the country, people, every state is wanting to order a machine, but they're not getting machines. So USAID, to directly from the US, we are getting this machine, and that will be a great benefit to the people of the state of Goa.
You mentioned about giving
And virology lab is already commissioned. So if you want me to take you for a round of the virology lab, no problem, we can go anytime.
Sir, when will JPL manufacture vaccines, sir? When will JPL manufacture vaccines?
I have no idea.
But the government, Goa is...
We don't need, we are getting all vaccines given by Government of India. I think that's good enough.
You mentioned about giving these facilities to various hospitals, like cath lab. You said you will be giving to district hospital. After this, will the crowds, the load on GMC will reduce?
Definitely. And I want to ask you a simple thing. Is why our plan was what? You build a South Goa district hospital. There is a proposal also now the Honorable Prime Minister has cleared. In order to increase the number of doctors, you can also go at a later stage for a private medical college if you want there, or you can have a government medical college attached to that particular. It's a government decision after the election, whoever wants to take that decision. But also, why do people from Kanpur need to come to Panjim for treatment? So what we thought is that for South Goa, if we have a cath lab, it will definitely reduce the load on the patients, and then they can get treatment there itself. And our facility hospital is excellent. It's a very good hospital. ना आता पळय सगळीकडे आम्ही पळयता की चडशे हॉस्पिटलायझेशन जायना. चडसो लोक घरा कडेन ट्रिटमेंट घेता. प्रत्येक मनीस डॉक्टराच्या संपर्कान आसता. इमिजिएटली आमकां म्हायती कळटा वेन पीपल कम एंड टेस्ट. And we have seen overall the trend that is there. Omicron is now spread. It's all over the country. Omicron now, whether you call it indigenous spread or you call it spread through somebody coming from somewhere, it doesn't make any sense because now Omicron is there. Now we have to deal with Omicron. We are not dealing with Delta per se. So the protocol for that is already laid down. But now the load, in anticipation that can be a load at some point, we have already made all the provisions. At stage 1, if we have X number of patients, where? At stage 2, what do we do? Stage 3, what do we do? Level 1, what do we do? Level 2, what do we do? Level 3, what do we do? That internally between the experts, they have already decided what's to be done. And I think we are pretty much comfortable at this stage.
Sir, कैसे challenging आता कि कोविड सिचुएशन 2.5 year में
चॅलेंजिंग आशिल्लेच न्ही. चॅलेंजिंग जावन सरकाराचो पूर्णपणे पाठिंबो, मुख्यमंत्री आमी सगळे एक टीम म्हणून आमी काम करून ते फुडें व्हरपाचो आमी प्रयत्न केलो. पूण त्याच बरोबर त्या अनुभवाच्या माध्यमांतल्यान आमचे डॉक्टर बी खूब शिकले आनी आमचे एक्सपर्ट्साक बी वेगळे तरेचो अनुभव आयलो. केंद्र सरकाराक बी वेगळो तरेचो अनुभव आयलो. सो दे गायड अस फ्रॉम टायम टू टायम. सो आय थिंक वी हॅव लर्नड अ लॉट ओवर अ पीरियड ऑफ 2 years.
What about now present situations of COVID? क्या लगता है कि टूरिज्म लास्ट न्यू ईयर और क्रिसमस में बहुत आया था. अभी क्या नाइट कर्फ्यू नहीं तो लॉकडाउन करने का जरूरी है?
So at the moment, if you look at, when you take a decision, it has to be an overall decision. Any decision the government takes has to think very wisely before taking a decision. Today, if you go to look at the situation, the hospitalization is very minimal. We find that the people taking treatment at home, and also the quarantine days or isolation days has been reduced from 10 days to 7 days. So things are evolving in a different way. So let us see how things move, and accordingly we will take a decision. It's not that we are not watching the situation. Every day we are watching the situation. We also know exactly in which place, how many number of cases are there, and minutely we are watching the situation. We will not allow it to go out of hand.
So one more thing is that this is different issue. As far as politics is concerned, there is a larger alliance which is trying to be built up against BJP. What is your say on that?
My say first is, when we are talking of healthcare, let us first talk of healthcare. हे जे लोक जे भायल्यान येता गोंया राज्यान, हांव तुका एलायन्साचेच सांगता, केन्जिलाक जाय एलायन्साची स्टोरी बरोबर सांगता हांव. एलायन्सची स्टोरी सांगता ती कशी एलायन्स आनी कितें एलायन्स ते. पयले गोश्ट म्हणजे भायले ते येता ते TMC येता, आप येता, ते हिरो जाले सद्या. कोण कोण इतले व्हडले उंच बिल्डिंगेन रावताय आनी बरे बरे लक्झरी गाडी चलयताय आनी ते तुमकां घोशणा आनी भाशणां दिता. ते मॅटर येता एक लक्षात घेवंक जाय की प्रत्येक मनशाच्या फाटल्यान कोण ना कोण पळयत आसता कितें चल्लां तें. आयज आप what is आप? Just because Arvind Kejriwal comes to Goa, that does not mean that people of Goa are going to vote for आप. After the last election, after they had a debacle in the last election, आप did not exist anywhere in the state of Goa for the last 5 years. In the last 5-6 months, you suddenly see that AP has suddenly put his head up because they feel that anti-incumbency is there. That is their imagination, and that they may be able to pick up 1 or 2 seats in the state of Goa. AP is not in the position to form the government, and today it is evident with one of the spokespersons of another party that has come from Bengal by saying that we will put BJP out. Let me see the desperation of coming to power. They only want to share the spoils of power. They don't know that the BJP government in the state of Goa is going to come back to power. BJP government in the state of Goa is very firmly in its saddle. Nothing is shaking us. Nothing. Their people have also tried to approach several leaders from within our setup also. Nobody is going anywhere. Because we have faith in our party, we have faith in the values and systems here, and we will fight it out, and we will fight this whole alliance together, because this alliance which you are talking of coming together, as we speak today, are on different platforms. So now, since they cannot cut ice with the people of the state of Goa, they are talking about coming together and trying to cobble up some sort of numbers which they will not achieve. As far as this party from Bengal, I thought the party from Bengal and my other friend who is with this alliance, I thought they will... they were pretty confident. They said no alliance with anybody. The idea of this alliance itself is a failed idea, because they are unable to cut ice with the people of the state of Goa, because they are unable to fight the Bharatiya Janata Party in the state of Goa. Nobody is talking of the Congress party. I don't know where the Congress party is. I don't know. It's absolutely relegated, or where it is, I cannot say. But when you talk, their alliance per se, their motive is only to come to power. Now that AP could not get any kind of traction in the state of Goa, since TMC and MGP could not get any kind of traction in the state of Goa, that is but obvious, answering your question, that they all want to combine, and consolidation, they say, Arey, what consolidation? Goa is not for sale. You come in 4 months and you try to say that you are trying to create some sort of thing. You work for 5 years. Do something for the people of the state of Goa. That Grah Lakshmi and all they got, and some youth card and all in your own state of Bengal. You come and plus give us statistics. What are the schemes you are running in the state of Bengal? How many schemes? Here Manohar Parrikar applied his mind. He had properly made provisions for funds so that we have Ladli Lakshmi and Grah Aadhar. After looking at our schemes, fooling the people of the state of Goa, giving forms, does not mean those people will get a single rupee, because they are not going to be coming to power. As far as this alliance is concerned, please note that no alliance, this is not an alliance. This is a failure of the opposition to attract the traction of the people of the state of Goa and faith of the people of the state of Goa. People of Goa are very intelligent. People of Goa are very sensible. People of Goa are very clever, and they also know where they need to vote and which party is coming to power. As far as I am concerned, Bharatiya Janata Party will get a full-fledged majority in the state of Goa. That is frustrating the opposition, as a result of which, out of sheer, she must have not realized that she is making this statement, out of sheer frustration, they said we all will come together. That means respective parties have failed in attracting that type of traction of the people of the state of Goa. Hence, that is the combination, one from Bengal, one from Delhi, where COVID was totally mismanaged. As a result, our leader, Shri Amit Shah ji, had to step in and virtually save the people of Delhi. Second thing, after saving the people of Delhi, creating infrastructure, Government of India played an important role. Hence, AP has no other things, but they only want to survive and have that kind of a segment of those few percentage of votes to be recognized as a national party. Just because you get some votes in XYZ place, that doesn't mean that in Goa you are going to get that type of attraction. The failure of AP to cut ice with the people of the state of Goa, failure of TMC and MGP to attract that type of attraction that they thought they would do, failure of those leaders who joined them thinking that they could make a difference in Goa, in the politics of Goa, is virtually they have failed, and as a result of which, the situation when a man like Reginald, working president, leaves the Congress party, talks about the Congress party. So if all these people have gone in different directions, all these people of Goa need to think that whether they want stability or they want these people coming from different parts. Look at the situation in Bengal. Do you know, I would like to draw your attention, do you know there was a situation when so many young small babies died in a hospital, government hospital? Did you forget? Is this government that could not save the lives of the small babies in those government hospitals in Bengal worth voting for? What is our mismanagement of COVID in Delhi? Pollution is at the highest. What is happening in Delhi? And what is happening? You suddenly parties that come after 5 years and in one after 5 years and one in 4 months thinks that they're going to do magic by just ready-made picking up people. I don't understand. People of Goa need to seriously do virtually retrospect and think whether it is worth voting for those parties or whether to stand by the Bharatiya Janata Party that has given a stable government for the last 10 years. It is easy to criticize the government, but do you think this whole combination, just now before coming here I read, somewhere it is said my friend Sudhin Dhawlikar has said that he is the Alliance Chief Minister. She contradicts by saying no, his supporters may have said it, but it is not the face of the alliance. So when so many faces are there to become Chief Minister, and here in Bharatiya Janata Party, the party of discipline, and when there are so many people there, I don't think that is a combination that people of Goa will vote. हायेन खंयचे पैसे दिता स्वतः हायेन सांगला सगळ्यांचे उजीर की स्वतःच्या राज्यान जेन्ना तुम्ही स्कीम चलू शकना, गोंया राज्यान तुम्ही ते स्कीम चलू शकना. आणि एक ते तुम्ही जेन्ना एक मिनिट अरे हांव उलयता ताका तेजें तूं उत्तर दिता. जेन्ना हायेन सगळी स्कीम पळयली बेंगॉलाची हांगा येवपाचे पयलीं, गृहलक्ष्मी म्हणून लोकांक पिश्यान काडटा ते, यूथ कार्ड केले म्हणून ते क्रेडिट कार्ड न्हू, नाल्यार तेंच्या सरकारांतल्यान बेंगॉलच्यान हाडान घाला म्हणून सांगा पयशे. त्या भुरग्यांक एक्सेस जावंक जाय कार्ड बिफोर इलेक्शन. एक मिनिट, गृहलक्ष्मी जावंक जाय बिफोर इलेक्शन. तुम्ही जोपर्यंत सरकार घडयना तोपर्यंत आमचे गोंयचे महिलाक ते 5,000 रुपया म्हयन्याक गावंक जाय. ते करू शकचे ना. बेंगॉलचे पयशे काय तुम्ही गोवा ट्रान्सफर करू शकना. आणि गोंयान आमी स्कीम चलयता, आमी स्कीम ऑलरेडी आमची इन प्लेस आहा, आमची कॉपी करून बेश्टे लोकांक दिशाभूल करपाक म्हणून हे स्कीम केल्या. लोकांक सांगता की फॉर्म भरल्यार तुमकां गावता. अरे तुमचं सरकारूच जायना जाल्यार तुमकां कशे पयशे गावतले? हांवें टिका करूं ना. ना हांवें फॅक्ट्स काडल्या फुडें तुमी. आमी हे पळय, हांव हांगा हेल्थ मिनिस्टर आहा, इंडस्ट्रीज मिनिस्टर आहा, वुमन एंड चायल्ड मिनिस्टर आहा आणि खंयचे ते स्कील मिनिस्टर आहा. ह्या संबंधीत तुका जाय ते विचार, ह्या संबंधीत तुका उत्तर दिता. बाकीच्या गोष्टी म्हाका ते प्रश्न विचारल्यार म्हाजे कडेन नॉलेज बी नसतली ते गोष्टी तुजे कडेन उलोवपाक. ना जावं शकता रे, हांव बी मनीस. Which one? Just because some party comes, today we are ensuring it's a responsibility when you make a statement and a commitment. I would like to ask this so and so spokesperson and this party that has suddenly started blooming in the state of Goa in the weather of elections is what is the manner in which you will provide funds? Where is the source of funds that they plan? We know for this scheme we are on track. Let them also tell us where is the source of funds they are talking about, how they plan to fulfill the obligations and the commitment made to the people of Goa, when simple 100 rupees they cannot do in the place of Bengal. आता गोंयान जे प्रेसान आमी विचारता की हे आपल्या राज्यान घालिना म्हणून कसली तरी स्कीम 500 रुपयाची स्कीम आयज 2022 ची स्कीम म्हणून आयज त्यांच्या राज्यान ते अनाउन्स केले, नॉट येट इम्प्लिमेंटेड. तुका जाय जाल्यार हांव रायट अप तेजेर दिता. आनी ते स्कीम ह्या तरेची स्किमा, इतलो व्हडलो राज्य आहा, ह्या राज्यान ही बाय मनीस असून ती विधवा बायलांक स्कीम ना, महिलांक स्कीम ना, कसलीच स्कीम ना. आनी ही गोंया राज्यान कितें येतली, तिका कितें दिसता की रेडीमेड आमदार गावले आनी म्हणून आमदाराक कितें वयर उखल्ले, तांकां हायजॅक केले म्हणून ते सत्ता येतली, तशी नासता. खोटी आश्वासनां कोण दिता? खोटी आश्वासनां दितात. जो पक्ष सत्तेर येऊ शकना ताका खोटी आश्वासन दिवपाक कांयच फरक पडना. म्हाजे विरुद्ध जर कोण मनीस रावलो तो कितेंय आश्वासन दिवं शकता, कित्याक तो निवडून येवचो ना. आज तुम्ही मिडिया सगळे बसल्या, म्हाजे विरुद्ध कोण रावलो म्हणून तो निवडून येवपाचो आहा, आनी निवडून येना तो मनीस कितेंय आश्वासन दिवं शकता. मागीर म्हाजेर पेज वाडटा की हांवें म्हाजेर पेज सध्या कांय ना, कारण आमी जबाबदारीनी आमी स्कीम चलयता सरकाराची. आमी खंय डिफॉल्ट जावंक ना. हे जे सरकार जे आहे, आम आदमी काय तृणमूल काँग्रेस जे आहा आनी एमजी पार्टी जे 17 वर्सां न्हू 30 वर्सां पयलीं गोंया राज्यान चलयताले त्या सरकारान म्हाजे वडील बी मंत्री आशिल्ले. तेन्नाची एमजी वेगळी आशिल्ली, आयजची एमजी वेगळी आहा. पूण कितें आहा तें एक लक्षांत तुमी घेवंक जाय की जे सरकार ते चलयतात ते आश्वासनां ते दितात ते स्वताच्या राज्यान ते दिवं शकले ना. आम आदमीन हे सगळ्या गोष्टी आपल्या राज्यान कांयच केले ना, टीएमसीन केले ना. म्हणून तुम्ही सगळ्या लोकांनी आनी गोंयचे जनतेन हेजेर मातसो विचार करपाची गरज आहा. थँक्यू.
आम आदमी पार्टी तुमच्या दरवर्षी मतदारसंघात सांगता की जमनीचो प्रश्न सोडयतले.
केजरीवाल खंय पावलो ताका परत एकदा विचार, तो म्हणटलो पणजेच्या भायर पावला म्हणून.